pelvimetry. So what is clinical pelvimetry? Measuring the bony pelvis or estimating or assessing the bony pelvis manually using fingers and hand is called clinical pelvimetry. So it is done manually at home, preferably at the beginning of the labor. So before doing examination, take consent, ask the patient to empty the bladder and bowel if possible, and patient is kept in a dorsal position and examination is done under aseptic technique. So what is the procedure? So first of all, doing PV, know the state of the pelvis pedal station, check for CPD in non-engaged head. So we'll check out CPD in examination. Then check the resilience of the perineal muscles, and then bony pelvis assessment is done. So what are the part of bony pelvis? Basically sacrum, pubic arch, uh, ischial spine, coccyx, sacrococcygeal joint, pubic arch, and iliopubic lines or eminence. So first of all, examining the cervix. So how do examine the cervix? So look at this image. So in this image, what you can see is that a finger is inserted like this, like this. Finger is inserted like this, and then sacral promontory is palpated, and the distance and the finger is taken on, and the distance is taken. So that is the diagonal conjugate. So this should be more than 11.5 centimeter. So from the sacral promontory to the fingertip. So a measuring tape is used to measure the distance. So that is the diagonal conjugate. So diagonal conjugate is the first thing. Then second is see the curvature of the sacrum. So sacral bones should not be palpable except the last three bones. Sacral bones should not be palpable. So if it is palpable, then that may indicate the inadequate pelvis. Another side walls. Examine the side walls. Side walls. How to examine? Is by examining the ischial spines. So this should be basically blunt. This should not be prominent. This should not be sharp, and the distance between them should be more than 8.5 centimeter. Sacrosciatic notch should be broad. 2.5 to 3 fingers should be fitting in the sacrosciatic notch. Then sacrococcygeal joint should be flexible. This should not be very stiff, and in anterior, palpate the undersurface of the pelvic symphysis. It should be smooth. There should not be any beaking or prominence of the sacral, sorry, pubic symphysis. Pubic symphysis. Then examining the outlet, insert a fist, make a fist and then insert it. Then it should fit inside. So that is intertuberous diameter between the ischial tuberosities. Two ischial tuberosities, the diameter should be more than 8.5 centimeter. Between the ischial spines, these two, the diameter should be more than 8.5 centimeter. And the sacrum should not be palpable. The sacrococcygeal joint should be movable. The subpubic angle should be more than 90 degree. The pubic arch should not be narrow. That is the thing all about clinical pelvimetry. Side wall should be divergent. A side wall may feel convergent in obese females. Okay, so that is all about clinical pelvimetry. And here it is given the adequacy and inadequacy of the clinical pelvimetry. So we are assessing basically the inlet, mid pelvis, and outlet in the clinical pelvimetry.